Hi, my name is Cindy Stein. I'm a licensed physical therapist and a certified Graston practitioner. Today I'm going to demonstrate Graston technique on the hamstrings. Graston technique is an instrument-assisted technique that uses various instruments to go in and break up scar tissue and adhesions in muscle. My patient here, Corinne, has had osteoarthritis in her knee for quite some time, and as a result of that, she has developed some adhesions in the muscle. I have actually found, even though I wouldn't have expected it, that Graston technique works actually quite well in quelling the pain of osteoarthritis. Now, in osteoarthritis, I would do both sides. I do the quadriceps and the hamstrings, but for the purpose today, I want to show you how I do the hamstrings. In general, the hamstring muscle tends to be a muscle that is quite tender, and it is a muscle that has a lot of strain to it and gets very tight. What I do first is I put an emollient on the muscle, and this is to allow the instruments to slide. The first thing I use is my instrument that diagnoses, and I will slide this both up and down on the muscle. And I can feel some grit right here. Do you feel that?
Mm-hmm. Yeah.
And it actually is bringing up red right away, which is indicative of there being adhesions in there. After I use that instrument, I then see where I've brought up some what would be called hyperemia, and I take this instrument and I begin scraping it. And you can see she is flinching. She's flinching because this muscle tends to be tender to treat. And she really has a piece of scar right in there. Do you remember any injury to your muscle here?
No.
After I use that instrument, I then can take what looks more like a butter knife, and I can come in here and go horizontal to the muscle, vertical to the muscle, and even in diagonal. And you can see she's turning quite red, and she has something right there. Okay. Next, I then do a dynamic approach to it to get the muscle fibers that have actually scarred in the process of muscle contraction. When a muscle contracts, not only does it shorten, but it also widens, and it's in the widening that we want to break up the scar. So I take and I have her bend her knee, and then I have her straighten it. And I do it in both an upward and a downward movement. Continue to bend it for me, Corinne. And straighten it. What would you say about this technique, Corinne?
I could definitely feel where the problem is right there.
Uh-huh. Is it tolerable?
Yes.
Feels good in a weird kind of way, right?
Right.
Okay. Graston
At
technique.
worst, it would be uncomfortable, but certainly not painful.
Graston technique is extremely effective in treating musculoskeletal problems. I highly recommend you try it if you have osteoarthritis of the knee. Thank you.